Welcome to This Explainer. Today, we're unpacking something that, well, it's a deeply painful reality for a lot of us, but honestly, very few people truly understand it. We are talking about being completely shut out. We're going to take a really focused, scientific look at the silent treatment. We'll explore exactly what it does to our brains, why people actually do it, and most importantly, how you can navigate it without losing your mind. I want you to think back for a second. Have you ever experienced what people call the deafening silence? You know the exact feeling I'm talking about. You ask a question, you try to engage, and you're met with absolutely nothing. Just a blank stare, a turned back, or maybe an unanswered text that just stretches out into days. If you've ever been on the receiving end of this, you know for a fact that the pain you felt was very, very real. It wasn't just in your head. And today, we're going to uncover exactly why that is. To get us started on the right foot, let's look at the clinical definition. Psychologists actually refer to the silent treatment under the broader umbrella of ostracism. It's simply defined as the act of being ignored and excluded by one or more others. Setting up this academic baseline is super important because researchers have been studying this intensely for over 5 decades. It's not just being petty, it is a recognized, profound form of psychological aggression. So here is our roadmap for the explainer today. We'll start with the deafening silence, then look at why social rejection hurts, peek inside the perpetrator's mind, examine the impact on victims, and finally, we'll wrap up with how to respond effectively.
All right, let's dive right into Section 1, the deafening silence and invisible injury.
And moving right along to Section 2, why social rejection hurts, the neurobiology of pain. Okay, what we really need to grasp first is that while the silent treatment doesn't leave any physical bruises, our biology shows us exactly why being ignored feels so agonizing. We always say things like, my feelings are hurt, right? But the science shows us it's way more literal than that. Researchers Eisenberger, Lieberman, and Williams made this completely groundbreaking discovery using fMRI scans on people who were experiencing ostracism. They found that being shut out triggered activation in the dorsal anterior cingulate cortex. Now get this, that is the exact same area of the brain that lights up when you experience a physical injury. So if you've ever felt like the silent treatment physically hurt your chest or made your stomach drop, this totally validates your experience. Social pain is physically processed by your brain. When we compare a physical injury and a social injury side by side, the biological overlap is actually kind of mind-blowing. Both of these events immediately trigger your sympathetic nervous system. In fact, down on a neurotransmitter level, social pain and exclusion are associated with changes in opioid and dopamine activity. Those are literally the very same chemical systems our bodies use to manage physical trauma. Think about it evolutionarily. Humans are social creatures. For our ancestors, being separated from the group basically meant certain death. So today, your brain still fundamentally processes the silent treatment as a literal threat to your survival. To help us understand how we process this threat over time, Dr. Kiplin Williams developed what he calls the temporal need-threat model. You can think of this as a chronological journey through the pain. First, you hit the immediate stage. This is where the silence hits you as a literal shock of distress, and honestly, it happens regardless of who is actually ignoring you. But human nature kicks in, and we try to fix things, which pushes us into the coping stage. Here, you're frantically scrambling to make sense of the situation and repair the bond. Finally, if this silence drags on for months or even years, the victim enters the incredibly dangerous long-term stage of resignation. This is where total exhaustion takes over, bringing on depression, helplessness, and just a really profound feeling of worthlessness. Now, the really crucial point about that initial shock phase is that the pain stems from the sudden destabilization of 4 foundational human needs. We're talking about your need for belonging, your self-esteem, your sense of control over your environment, and your belief in a meaningful existence. The silent treatment attacks all 4 of these vital pillars at the exact same time, basically pulling the rug right out from under you. Let's shift gears to Section 3, inside the perpetrator's mind, intent versus deficit. You know, it is so easy to just assume that the silent treatment is always a form of manipulative abuse, like it's this calculated tool used purposely to control you, punish you, or feed a narcissistic ego. And sometimes, sure, it is. But the reality is often quite different. In a lot of cases, it actually stems from profound emotional deficits. A person might be so deeply overwhelmed by distress that they experience what's called emotional flooding. They literally physiologically shut down and just cannot process information or speak. For other people, it's a deeply ingrained learned behavior from childhood, this really misguided belief that going silent is somehow safer than arguing.
It is absolutely vital that we distinguish between calculated malicious abuse and someone who is just emotionally unequipped to communicate in a healthy way.
In a lot of those non-malicious cases, the silent treatment is really just a broken defense mechanism. For folks with avoidant attachment styles, shutting down is how they protect themselves from emotional exposure and vulnerability. They are terrified of conflict, and so silence becomes their shield. Now, to be clear, that doesn't make the behavior okay, and it certainly doesn't make it any less painful for you. But understanding this helps us realize that their silence is often about their own internal fear. It's not about your inherent worth.
Moving to Section 4, the impact on victims, the toll of silence. The psychological toll of prolonged ostracism is honestly just devastating. Victims almost always experience deep confusion and anxiety, mostly because they completely lack any sort of closure. If you've been through this, you know all about the exhausting hypervigilance. Staying awake at 2 in the morning, analyzing every tiny little detail, replaying conversations over and over in your head, just desperately trying to figure out what you did wrong. Over time, like we saw in the resignation stage earlier, this chronic stress completely drains your coping resources, and that leads straight into reduced self-esteem and depressive symptoms. Faced with this total loss of control, victims generally take one of two pretty desperate paths during the coping phase. A lot of people become overly compliant. They'll start mimicking behaviors, conforming, basically walking on eggshells and doing absolutely anything just to win back some affection and restore that sense of belonging. But if re-inclusion starts feeling completely impossible, victims might swing to the other extreme, aggression. When a person feels totally and completely invisible, lashing out aggressively becomes this desperate last resort strategy. They're just trying to force the perpetrator to finally actually acknowledge their existence. All right, let's get to the solutions in Section 5, how to respond effectively, breaking the cycle. So, how do we actually break this destructive cycle? If you find yourself on the receiving end, here are 4 highly effective, actionable steps to protect your mental health. First and foremost, and this is crucial, assess your safety. If the silent treatment is part of a much larger pattern of domestic abuse, you need to contact a professional hotline and create a safety plan right away. Step 2, assuming you are safe, use assertive communication. Stick to clear I statements like, I feel hurt when you stop talking to me. Whatever you do, never engage in a power struggle or beg for their attention. Step 3, set really firm boundaries about what behavior you will and absolutely will not accept. And Step 4, seek out professional help, like counseling, to help you process that heavy emotional toll. On a day-to-day basis, you can use a few specific coping tactics just to protect your nervous system. Employ mindfulness and healthy distractions so you don't fall down an anxiety spiral. Actually, you might want to try Yoga Nidra. It's this profound, deep relaxation technique that works wonders for resetting a stressed mind. Also, the research highlights a fascinating tactic called angulated mindful listening. Basically, if you absolutely have to be in the same room as the person who is ignoring you, practice sitting or standing at an angle to them instead of directly face-to-face. It sounds simple, but this subtle physical shift actually allows the negative waves of their silence to just pass right by you. It helps you stay present without absorbing all their hostility. If you take only one single thing away from this entire explainer today, please let it be this. The silent treatment is a reflection of the other person's inability to communicate effectively. It reflects their lack of emotional regulation. It is absolutely not a reflection of your worth, how lovable you are, or your character. You cannot control their silence, but you absolutely can control your own healthy, bounded response to it.
Let's wrap up with one final, kind of tough thought. If you are someone who tends to shut down during a conflict, I really want you to look at this question and be incredibly honest with yourself. Are you using silence because you are genuinely emotionally flooded and just trying to protect yourself? Or are you using it as a weapon to punish someone else? Understanding your own motives is literally the very first step toward choosing a healthy connection over the deafening, damaging roar of the silent treatment. Thanks so much for joining me for this explainer, and hey, take care of yourselves out there.